Good afternoon, and thank you for having me here today. My name is Lydia O'Meara, and I would like to first acknowledge the Yuganji and Jabagai nations and other traditional owners on whose lands I live and work, and honor their elders, past and present. I am naturally a quantitative researcher, and as a kid, my mum likes to tell the story of how I used to open the cupboards and line up all of the cans of food so that the labels all faced forward. You might have sensed a theme, food and details. So it is probably no surprise that I have ended up in the middle of a PhD researching what people eat. Today I will share a few of the research lessons I have learned from two projects. One studying the diet diversity of vegetable farming households in Fiji with the Australian Centre for International Agricultural Research. And the second, studying the impact of COVID-19 on food environments, which I'm working on with the United Nations System Standing Committee on Nutrition. Now, other than being one of the most overused words of 2020, what does resilience mean? This conversation started with Liz about a year ago when she said, I'm trying to figure out how to make the ED system more resilient. And I said, well, would you believe it? I'm trying to figure out how to make food environments more resilient. Like any good science fields, nutritionists are still hotly debating the definition of resilient food environments. However, of all the definitions I have read, there seems to be one fundamental truth, and that is that resilience is broadly defined as a system's ability to meet objectives in the face of challenges. Resilience is not just merely about withstanding shocks, but more importantly, it is about the ability to learn and adapt. In the nutrition world, we are always trying to figure out ways to keep people healthy. In other words, to eat more vegetables and hopefully keep them out of hospital. I won't bore you with the conceptual food system frameworks that we like to work with. But needless to say, unhealthy food environments and the nutrition transition to a more modern processed diet can lead to unhealthy diets. So we are always trying to figure out ways to make the food environment healthier. And what better place to study this than the Pacific Islands that unfortunately has one of the highest rates of overweight and obesity in the world. When I first approached the university about undertaking my honours year of research in Fiji, they were understandably skeptical. I was told that it was unlikely to be successful. You will need to pass international ethics, and even if you do pass ethics, it can be difficult to get people to engage. Coming from a quantitative background, I wanted to conduct a survey which required at least 100 responses for a pilot of this design. I was advised that this might be difficult and that I should have a backup plan. Hold a couple of focus group discussions, a few people advised, so you at least have something to write about in your thesis. However, much to our surprise, it did turn out to be more a success than maybe we thought it would. In total, 161 Indigenous Aitakai households participated in the survey, and 80 women and 33 men participated in the focus group discussions. In the end, we had more people want to participate than we could accommodate, which is not exactly what I was expecting. We also got international Fijian ethics approved in 3 months. It was stressful at the time, don't get me wrong, but I have since learned it is unusually fast. I have colleagues from other universities that have taken up to a year to have their Fijian ethics approved. Although it took 8 levels of approval, in hindsight, the process made me engage with multiple stakeholders to ensure that the study was needed, necessary, and wanted. So why was this project successful, you may be asking? With hindsight, I would say this project was successful because of the power of collaborative research. Meet my Fijian co-researcher, David. Not only had David been born in Singatoka Valley and knew just about everyone, he co-designed the project and co-authored the subsequent paper. This project was also successful because of Andivika, Manimua, and Siti, the extension officers from the Ministry of Agriculture that knew every farmer from the coastline all the throughout to the highlands. And because of Alessi and Luata, the outreach nurses from the Ministry of Health that, like any good nurses, knew their stuff and didn't take nonsense from anyone. And because of the village healthcare workers that knew every woman in every household in every village. In university, they teach you to be a systematic, rational scientist. They teach you how to see everything as a series of numbers, coding syntax, and graphs. This might seem obvious to others, but in Fiji, I learned that research is about humans and existing community networks. More importantly, I learned that there are two fundamental ingredients to successful collaborative research: rapport and time. It is the collaborating partners that knew what was the best study design, what was important to the communities, how to engage participants. Ultimately, it was the collaborating partners that were the experts. It takes time to build rapport, and I can't emphasize this enough. Funders and universities are always about deadlines and results. However, collaborative research, I've learned, will always take more time than I expect. I learned very quickly that I had to slow down. I had to unlearn much of what I thought was research, and I needed to trust and follow in the steps of my Fijian co-researchers. I did my work placement in Fiji and got to know the in-country partners long before my honours research project started. David and I worked together over Zoom for nearly a year before fieldwork started, and we liaised with multiple levels of government to ensure we had the right approvals. Even when fieldwork did start, the team and I committed a week to visiting each village to introduce ourselves and ensure the village chiefs and elders were again happy for us to proceed with the study. Every spare day that we had, my research assistant and I hung out in the Singatoka markets and the Ministry of Agriculture to get to know the local community. And I also learned that rugby is important, of course. This was 2018. Fast forward to February 2020. At this point, I was back in Australia trying to start my PhD. I was supposed to be planning fieldwork in Peru, but of course COVID cancelled those plans. By the end of March 2020, the pandemic had well and truly started. And as you can see in this map, 96% of countries worldwide had enacted some form of measures or lockdowns to contain the virus. Before the pandemic, the world was not on track to meet the Sustainable Development Goals. And as with many sectors, whether you work in health systems, food systems, or environmental systems, COVID-19 exposed large cracks in food systems, with supply chains struggling during lockdowns. In just 1 year, the pandemic pushed a further 320 million people into food insecurity, which is the equivalent of the last 5 years combined. Add to this, a further 116 were pushed into extreme poverty, which is defined as living on less than US $90 per day. It was at this point that one of my supervisors connected me with two researchers at the UN Standing Committee on Nutrition. They had conducted an online survey in March to assess the impact of COVID-19 on people's food environments. I signed on as a consultant to analyze the data. This should be relatively easy, I thought. Back in my comfort zone, all of my favorite things. Existing data which I can download, numbers, writing syntax in SPSS, creating some pretty diagrams and graphs, all done by 4:30 p.m., dust my hands off, head to the pub. Or, at this stage of the lockdown, Friday Zoom drinks with friends. Except I didn't realize someone had added open comment fields at the end of each survey section. There were over 1,000 free text comments in 8 different languages: Arabic, Chinese, French, Italian, Portuguese, Russian, Spanish, and English. It was at this point I could hear a qualitative research colleague in my head. This lady had over a decade of experience conducting qualitative research with Indigenous communities in Central Australia. I was fortunate to have her train me before I left for Fiji. There were a few things that she said that always stuck out to me. Qualitative research is an opportunity to give people voice, to understand the how, what, and why of a concept. At this point, the data had given us some interesting statistics on food acquisition practices during the second month of the pandemic, from over 2,000 individuals from 119 countries. But as with any kind of conventional survey, the results are only as good as the questions. I sat back down. I spent 2 hours copying and pasting text through Google Translate. Given it was a rapid assessment online survey that wasn't designed to collect a large volume of qualitative data, the richness of people's perceptions and experiences that they were willing to share surprised me. Although we found all of the usual suspects, that mobility restrictions, food shortages, and loss of purchasing power were common barriers to food security, in the free text comment fields, we also found households and communities were describing resilient behaviours. People were adapting. When they couldn't get to a farmer's market, they started buying local produce direct from the farm. When they saw local businesses struggling, they started to buy more locally. And there was a real sense of community solidarity. By using social capital, that is existing relationships and trust, they asked for help with grocery shopping while others were growing and sharing food with their neighbours. Some communities were mobilising existing civic groups to deliver food to vulnerable people, while governments mobilised more formal food banks for support. People were adapting and learning new recipes to make use of the ingredients that they had at home so they didn't have to shop as frequently. In other words, they were building their food literacy skills. Some were becoming more aware of their food waste and were trying to reduce it. People said they were more health conscious and were taking the opportunity that most of the takeaway shops were harder to access to eat healthier at home. Now, of course, with any rapid assessment survey, it is not nationally representative. However, it does provide a snapshot of people's experiences and responses to disruptions in their food environments during the early days of the lockdown, which can provide insights for future research. During travel bans, many researchers thought that qualitative research would be difficult, if not impossible, and in some respects, their concerns are valid. However, it turns out that something as simple as an open text comment field can prove to be surprisingly powerful. At this point in my career, I am wondering what all this means for my research journey. As an early career researcher, I have more questions than answers. In fact, what is it that we are talking about, and has it been defined? Is this called collaborating better with research partners, as quantitative researchers like to say? Is this called taking a participatory approach, as qualitative researchers like to say? Or is this called a human-centered approach, as defined by UNICEF? Or is this simply about keeping an open mind and being willing to have my assumptions challenged? Or, as one of the more engaging debates I attended at a recent nutrition conference, is this about decolonizing research? What I think it means to me is acknowledging that research is not just about numbers, but remembering that it is about humans. And as an early career researcher that is trying to become more resilient, I think it also means that I need to embrace the process of unlearning, relearning, and adapting. Thank you for listening.